Winston.
Yeah, Winston Unplugged.
Yes, Winston Unplugged. Winston is a dragon boat racer that he can explain that. But you were chosen, you're a physician who is passionate about eliminating disparities. It's been your life's work. You're a champion for improving health care for vulnerable populations. So I'm very interested if you would paint us a picture of your dream of eliminating health and healthcare disparities. Or is that possible?
Well, I do think it's possible, and I'm an optimist, but I think part of this journey, part of the challenge is to change the vernacular as well. I'm one of the advocates that says that we need to stop talking about health disparities and start talking about health equity. And if we have health equity squarely in the picture of what we want to achieve as a country, as a nation, we're going to actually make much more progress in terms of identifying where disparities exist and then trying to plug the holes in. And I was actually thinking about this question last night, and I said, what's the synopsis of the so-called health disparities, health equity work over the last 20 years? And this is how I kind of thought about it. I think the first wave of health disparities work was basically race matters, race being racial justice as being kind of the touchstone in which we understand interactions that take place in the healthcare delivery system, unconscious bias, access issues, disproportionate lack of opportunity, et cetera. And that was really a lot of the discussion that occurred, I think, about 20 years ago. And much of the work around cultural competence is based upon a perspective that race, nationality, immigration status, et cetera, compound the difficulties in terms of individuals accessing health care. But in the last 10 years, you know, it's now not just race matters, place matters. And many have heard about zip code is more important than your genetic code. And to Steve's point, place matters as a proxy for understanding social determinants of health, i.e., do communities have access to jobs? Do communities have access to fresh food and recreation? Do communities have access to educational and job opportunities? Which has moved the discussion forward. I think it's not that place trumps race or race trumps place. I think we're starting to understand there is a confluence of factors that come into the question of health disparities. Now, the third part of this, which I think most recently has started to enter the discussion around health equity, and I was trying to be pithy about this, is fate happens, F-A-T-E. Now, you can use a different noun other than fate if you want to think of it that way. But the reason why I think that's really important is that most recently the work and study has been around how do individuals who live in certain communities live with the stressors of racial discrimination or national discrimination, homophobia, you name it. How do these psychological stressors eventually exemplify in terms of physiologic manifestations and subsequently the disproportionate burden of disease and a disproportionate development of chronic disease? So if you think about race happens, or race matters, place matters, and fate happens, the question for us as healthcare providers, and I'm part of a large healthcare system, is how we interface all of these elements. And then by extension, the question of how does health literacy fit into some honest discussions about how patients understand their health, and dare say not just patients. At Kaiser Permanente, we use the vernacular members, but I think it's really about individuals. The kinds of conversations that we have to have in real terms in terms of what is the value proposition to you in terms of achieving the most optimal level of health, wellness for yourself, what's meaningful for you, and to put that in terms that the healthcare system understands as people articulate that, and that people understand what we're trying to do to be patient-centric. So I think, I'm not sure if I touch upon your question in terms of what it will be in 2024, but I know that the discussion is starting to mature, to really understand it's much more complex than just one issue. It's about how all these things interface with one another, and how we get into the complexity of how individuals and thus communities are able to interact with the healthcare system. And there's a lot of implications for what that means in terms of how health plans like mine interface and support the development of communities and individual empowerment. A lot said there, but.
Well, one of the key points for me is the field or the concept or the awareness is evolving and growing and changing. I mean, life is dynamic. And so given that, I mean, what would you see? I'm all about action plans and baby steps. So what are some initial things that you would like to see done?
Well, I think one thing is, I think Steve said, and another speaker also said earlier today, health in all policies. Okay, so we look at whatever we do in social policy, whether it be development of schools, et cetera, transportation, infrastructure, how does it impact health? But I think underneath that is also a question of equity should be at the question of all health. So I have seen over the last 15, 20 years with the release of the quality chasm, if you look at the 6 pillars of a quality healthcare system, safety, timeliness, efficiency, effectiveness, patient-centered, the question of equity comes in as a derivative of the first 5, as opposed to being at the center of how we understand how the other 5 are achieved. So the question in my mind, the question I would push, is for all healthcare systems, all healthcare providers, all entities that say they're concerned about public health and community health, is by what basis and what metrics and what evaluation do we see that equity is enhanced under any other policy when we go towards trying to achieve health. And I don't think we've actually formalized what those measures are. I'd like to push for a certain set of core features that embody the issues of equity, of which health literacy is certainly one of them. How does health literacy become part of the calculus in which you understand how health equity is achieved in a given community or given target population?
That was my next question.
What are the measures?
Well, how do you see health literacy playing a role in equity? And do you think health literacy is over-promising what it can offer?
Well, it's really interesting. I was in a conversation last week with Kaiser Permanente leaders, and we were considering this whole area of the so-called non-medical social needs of members and patients. Because we, as a prepaid health plan, we understand that it is actually a losing proposition to just kind of figure out what the budget should be to look at how you're going to provide intensive crisis care, as I think someone else mentioned earlier today. We understand that ultimately, for people particularly who are very ill, what surrounds them in the family, what surrounds them in the community, what surrounds them in terms of what social structures there are to support themselves to stay out of the hospital and not get further ill, is around social needs and life needs. So then the question is, when we enter into those discussions, how real are those discussions with people? So we are entertaining the questions of when you talk to people and you see them for that 15 minutes out of 365 days a year, what is the core conversation that resonates with them in terms of what it means for me to be to go on this journey of keeping as much health as I can? And I think one interesting proposition is, should we start a discussion with every person that we come in contact with is, what does a good day mean for you? Because that's really a much more important question than what hurts, what's your disease, have you been taking your medicine, but what is a good day for you, given your current situation of health or illness? And let's work upon that. Part of the medical armamentarium can help with some stuff, but ultimately, what is a good day for you is a question of the constellation of factors that foster health. And we as a health plan have to think about what do we do proactively to address what makes a good day for you.
I love that it's starting with the patient and where they are. And even somebody who's had heart surgery and a pacemaker, it's like, well, it's the new normal, and you just deal with it and go on. And so it's like starting with the patient and where they are, what's a good day for them. But that's a lot of social determinants. I mean, can you measure that?
Well, I think one of the challenges we have in health literacy, and I think we touched upon it earlier, it still tends to be framed within the question of clinical interaction. And I think if we're thinking about real health and investment in communities and with individuals, it's not around clinical care that makes a difference to them. It's around the value proposition to them in terms of what decisions they make, whether it's behavior change or taking a medication or getting support from loved ones that enables them to function at a level of joy and happiness in their lives. And if we are able to kind of capture that in a way that is not just used by the physician, not just used by the nurse, but the entire healthcare team, and dare say by extension, the ways that in 2024 health plans are going to touch people, which will not largely be in the face-to-face interactions, it's going to be more virtual. How do we have the value proposition and craft the language so it resonates with people? It's not so much about the terminology anymore. I think it's about the narrative that takes place between people who provide and support health and the individuals who are partners in that journey.
But one kind of boring question then, and I hate to end with this, how do we measure that? How do we know we're doing better? How do we know that things are improved, besides maybe patients being more satisfied?
Well, I think it partly is going to be those kinds of questions. Does your health plan or does your health provider meet your needs to live the best day that you had today? Okay. I mean, those are so far few for the kinds of measures we have as clinical care systems. And then from a very pragmatic health plan perspective, I'll be very transparent. Kaiser Permanente gets $50 billion in operational revenue a year. How much are we actually putting out in terms of these crisis-oriented, intensive chronic care centers? We're going to have to look at that denominator, the numerator, in terms of whether people are getting value, purchasers are getting value for the care. We would want to see the measure ultimately is that we're spending much more on wellness and social services, and we're spending a lot less on really high-cost, intensive medical therapies.
Well, I think we've had a great panel, and George, I'm ready to turn it over to you.